Hello, we're here today to give you, the members of our Nashua community, an update regarding the coronavirus pandemic, the status of our efforts here in Nashua. Of course, I'm the Mayor, Jim Donches, and you're also going to hear from Bobby Bagley, who's the Director of Public Health and Community Services, Justin Cates, who is our City Office of Emergency Management Director, and Sarah Marchant, who's the Director of Community Development. Now, I know we're all a little stir crazy from being home for these months, but what we're doing is definitely having an effect on the spread of the coronavirus contagion. We're doing the social distancing as ordered by the Governor Sununu, and the idea is to keep people apart, to make it so that we have a lower peak of cases, and so that we again can make sure that the hospitals aren't overwhelmed. And so far, it's going pretty well. Right here in Nashua, we have about 200 cases so far, 203 as of this morning. And many of those people have recovered, and you'll get some specific numbers from Bobby Bagley, Director Bagley. Most of them have recovered, but there's certainly still around 70 active cases. Now, our public health department is working hard with the people who have tested positive, and they're doing what we're calling test, trace, and isolate. So the first step is the testing. And the point there is we want to get as many people tested for COVID-19 as we possibly can. Now, this has been difficult until the last week or two. Before that, the tests were very, very scarce. And that is a national shortage. Nothing that's been done either in Nashua or New Hampshire has caused that. The state is working hard to get as many tests as they can. But unfortunately, the national government has been slow in ensuring that testing is available. So within the last week, 2 weeks, the testing here in Nashua has become more active. A week ago, our public health nurses, in concert with the state, tested about 150 people. Then yesterday, our public health department tested about 40 more people at the shelter operated by the Nashua Soup Kitchen. And next week, there are going to be several days on which the health department is going to be doing testing. So tests are becoming more available. It is the state's goal to test 1,500 people a day statewide. Now, that goal I don't believe has been reached yet, but they're certainly making progress in testing at least 1,000 people a day. And of course, as I've said, our public health department is active in that. Now, if you have symptoms, you can get tested, and you should call public health to arrange an appointment. These tests are by appointment only, so that they aren't flooded with people standing in line altogether. You need to call the COVID-19 hotline at the public health department. That is 589-3456. So the second portion of this, the approach, the testing, tracing, and isolation procedure is tracing. So our public health nurses and others working with them talk with each of the people who has tested positive and begin to trace all of the contacts that the people have had over the days before their symptoms arose. This would include, of course, family members. This would include anyone that they had contact with at work or at the store. And here is a graphic that shows you gives you a little idea of how this tracing process takes place. You see in the center of the slide that a hypothetical person named Bob has the COVID-19 virus, and the people being traced are the people being contacted and by our public health department are the people Bob has run into over the days before Bob developed symptoms. So you see in the middle are his family members. Public health would contact all of those people. But you also see that Bob contacted other people, friends. He also went to work, so he's contacting coworkers. So he's been in contact with coworkers, and then he went to the grocery store. So public health would identify who the friends are, identify who the coworkers are that Bob ran into, and also the people that try to identify the people he might have run into in the store, and talk with those people to tell them that they should then take the next step. And the next step is isolate. The idea there is to find who might have had contact with a person who is tested positive and get them to quarantine for 14 days so that if they contracted the disease, they don't spread it to anyone else. And that's the isolation part. So, what our public health nurses are working on again is testing, tracing, and then isolating. And this is the way to contain the spread of the coronavirus in New Hampshire and in Nashua. This is a procedure that has worked elsewhere in the world, Singapore and other places. That's what we're working very hard on. And I want to thank our public health department for being so proactive with this approach. There's something else that I wanted to tell you about that is a really uh, interesting and for us a very positive development. And that is that the CDC, the Center for Disease Control, is the central agency for the federal government that is involved with combating any type of infectious disease. And they're down in Atlanta. They have a nonprofit foundation called the CDC Foundation. And we, the public health department of the city, were contacted by the CDC Foundation, who has observed the very effective work that's being done here in Nashua and offered 4 employees to help us, paid for by them entirely, by the CDC Foundation, offered to pay for those employees entirely so that those 4 people could work here in Nashua and supplement the efforts that we are doing locally with public health. So we're very proud, we're very happy that this is going to begin. This agreement with the CDC Foundation was approved by the Board of Aldermen just on Tuesday night. So the city, in conjunction with the CDC Foundation, is going to now interview and hire 4 people at, again, the foundation's expense, no cost to the city, who will work with our city health department, with our emergency management director, to supplement our anti-COVID-19 efforts. Now, again, I need to remind you that we want to continue to do the social distancing. That is, stay at home as much as you can. Make sure that in public you wear a mask. Make sure that you stay 6 feet apart from other people. And this is, again, part of our effort to to combat the COVID-19 virus. Now, Governor Sununu from the state of New Hampshire has a stay-at-home order and also has ordered that various businesses be closed, again, in an effort to make sure that the virus doesn't get all around the state. Right now, the state has a little over 2,000 cases, but it could be much, much worse. Now, the governor is holding a press conference at 3 o'clock, an hour from now, in which we expect that he will make some new announcements. We're not sure what those are, but I know that they are thinking about trying to gradually reopen the businesses, restaurants, and other things, reopen the economy based upon the facts in front of them, the number of cases, the growth of cases, and what they're looking for is several factors. Right now, about 9% of the people who are being tested, according to their statistics, are tested positive. And as the testing goes on, they want that number to decline, 9, 8, down, keep going down for a period of 14 days. In addition to that, they want the number of new cases that arise in the state on a daily basis to decline for a period of 14 days. So what we've seen recently is that the number of cases in New Hampshire has leveled off, the number of new cases, but is not yet uh, indicated any serious decline. And also the percentage of people being tested that do test positive has leveled off, but we need to see a decline there. And when we see declines in both of those figures, then we know that the virus is beginning to the 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 spread of the virus is diminishing, and in other words, less people are infected, and less people then are likely to be infected. But we're looking very hard. For the day when we can reopen, at least in part. But of course, we are following the leadership and the guidance of the state of New Hampshire, who are looking at the science, looking at all of our statistics very carefully. So we are here to serve you. I want to thank all of the people who work for the city, who are doing so much to keep city services, essential city services, going during this time of crisis. Of course, our public health department, but also our first responders, our police, our firefighters, also our teachers. They're teaching remotely. That is not an easy job. Talk to any parent. They will tell you they're learning that teaching is not easy. We also have public works. They're picking up the garbage and beginning to work in the parks, again with social distancing. We have our transit system. They are working to deliver food to kids who don't have enough to eat. So I want to thank all of our city employees, and of course all of the volunteers that are working so hard across the community to provide support for those who need help, and the efforts to feed the kids. Many volunteers involved who don't have enough to eat, but also many outreach efforts, sewing masks, making masks, and other things that our volunteers are doing. I just want to thank everyone. We are all in this together. If there's a silver lining to this cloud, it has really pulled all of all Nashuans together, a solidarity in working together to limit the spread of the coronavirus. So again, thank you to all of the people involved. If you have any questions, please don't hesitate to contact the COVID-19 hotline or the mayor's office. We're here to help. We're here to serve, and we will continue to update you, keep you informed on a periodic basis, usually once a week. So with that, I'm going to turn you over to Director Bobby Bagley, Director of Public Health, who can talk more about the efforts we're making on the COVID-19 front.
Thank you, Mayor. And hello, Nashua. It's a pleasure to be here this afternoon to share what we've been doing over the past couple of months during this event with COVID-19. And what I want to do is, again, share some of the information at the global level, at the national level, and then bring it home to our state in New Hampshire and Hillsborough and down to Nashua. So as you can see, we're up to 3.2 million cases now reported globally, with over 233,000 deaths. So as the mayor said, we continually see cases increasing, and this is globally, and we continue to see deaths as well. In the United States, we have over 1 million cases that have been identified, with over 63,000 deaths reported as well. And so again, we continue to see the activities of this virus, and for that reason, we continue to need to be vigilant with our efforts in stopping the spread. If we bring it home to New Hampshire, we have over 2,000 cases that have been identified, and we have about 46% of recovery rate, which is really good, because that shows that people are getting better. We have a 12% hospitalization rate, and so what that lets us know is that there's still individuals in our communities that end up being hospitalized because they need that type of care 24/7 in the hospital. We also have had a 3% death rate in our state overall. The recovery rate is something that's really good for us, because some individuals can actually stay at home and recover from this disease over time. That 12% hospitalization rate is what we want to keep low and even lower than what we see. And of course, we definitely want to bring down the death rate as well. In Hillsborough County, we have had over 964 cases, and we've experienced 36 deaths. And this is data that was presented to us from our state as of yesterday. So when we bring it down to Nashua and what we've been seeing today, we have 203 cases that were reported. We had an increase of 10 cases from yesterday until today. Our public health nurses are actively investigating 76 cases and also following 130 contacts. And we have volunteers that are working with us to help us make the calls that are needed to do symptom tracking and also to follow these individuals until their quarantine or isolation period is up. Nashua has seen 8 deaths over the course of this time, and we have a 54.6% recovery rate. Our data looks a little bit different than the state rate, but we are monitoring that very, very closely. Our goal with what we've been doing with testing is to make sure that we can keep these numbers down low. And if you look at this graph here that shows what Nashua looks like in comparison to Hillsborough County and New Hampshire, the lime green is the New Hampshire line, the blue, sort of royal blue color is Nashua, and Hillsborough is at that navy blue line. And you can see Hillsborough and Nashua are above the line for the state, the number of cases for the state per 100,000. And at one point in time, you can see where somewhere in around the 21st, 22nd of April, you can see where there was a change off between Hillsborough and Nashua. And that's because of the number of cases that have increased in not just Manchester, but in other parts of the state where the case number has gone up. And so you can see that we're just below the Hillsborough line, but we're above the state line for New Hampshire overall. As we continue our efforts, as the mayor talked about, we're increasing our testing. This is really important. It's important for our country as a whole. It's important for us locally in our state of New Hampshire and in Nashua. The more testing that is done, the more cases are identified. And when those cases are identified, we can isolate those that are active and we can quarantine those who have been in contact with those active cases. And the mayor did an excellent job of showing what happens when there is an individual that has been identified as a positive case and just how thorough the job that needs to get done with the contact investigation has to happen. We need to know who all those individuals are. With that contact investigation, when we're asking the very specific questions of, how the exposure could occur between others, we really want to know, how long an individual may have been exposed to the person that was identified as a positive case. And so it's got to be a sustained amount of time, over 10 minutes, with the individual. So if you're just walking past a person, that's a really low exposure. But if you spend at least 10 minutes or more in direct contact with an individual, less than 6 feet apart from them, there's a high risk of exposure, especially if it's unprotected exposure. An unprotected exposure is if you don't have that face covering, the cloth mask that we've been asking our individuals in our community to wear, especially when you can't maintain that social distancing. So our testing is done so that we can identify as many cases as we can. And again, have people in isolation or in quarantine so we can reduce the spread. And as you can see from this chart here, you can see the testing rate here. The total number of persons that have tested is over 20,000. And that's because we've increased testing as of last week. On average, there's about 885 individuals that have been tested in New Hampshire. The governor has put out, a mandate for at least 1,500 tests to be completed in the course of each day. And so we're working as hard as we can to get to that goal. And you can also see the negative test. That number is up there pretty high as well, just below 20,000. And then you can see the number of individuals that are testing positive. And so with those that test positive, again, we want to make sure that we reach them as quickly as we can to identify their contact. The second graph there just shows the number of calls that we've received with regards to COVID-related case calls on our hotline. And those calls may range anywhere from just everyday questions about the disease itself to testing. And there you can see that there was a spike there when we had our mobile testing last week. And we also are getting increased calls because we are planning to do more testing in this upcoming week as well. The two test dates that we have coming up are going to be on Monday and Tuesday. Monday, we're going to be testing at the Community Chapel Church of Nazarene over at 5 St. Lawrence Street, and that is off of exit 7E. We want to make sure that people know they have to call our COVID hotline, the number that the mayor just gave earlier, 589-3456, to make appointments. That is a drive-through testing site only. And then the testing on Tuesday will be at the library. We do still need people to make appointments, and that's going to be a walkthrough. We're trying to make things as accessible for those who want to be tested. And you can see here the demographics that we've had so far and the testing that has been done based on age and also based on race and ethnicity. There's been some data that has come out that shows that our populations that represent racial and ethnic minorities has some disparities with regards to the impact of COVID-19. And so we're intentionally making sure that we test that population as broadly as we can. And just from the clinics that we've done so far, we've been able to test at least 3.8% of the number of folks that were tested out of the 151 last week, represented the Latino population, and the African American population that was tested was 13%. And that shows a good proportion when you think about the population of the state overall. And this slide just shows here our Nashua population, and then it shows the testing of the individuals that were able to make it to the testing last week. And so again, a good indication of the intention that we have to make sure that we get that population tested, get folks connected to the resources that they need so that we don't see the impact that a lot of states are seeing with the disproportionality of individuals representing the racial and ethnic minority populations with higher deaths as a result of COVID. We need for people to get access to care sooner, and we need for them to be aware of their status as well. Now, I did want to also share information about the different types of testing. So the testing that we're doing right now is the PCR testing. That's a test that actually allows for us to know when there's acute disease within an individual in the population. The state also sent out information about antibody testing, which will allow for us to know who has had the disease and who's recovered from the disease. And that will give us an indication of what we call community immunity or herd immunity, based on who in the community does show that they have mounted antibodies in response to their exposure to the disease itself. So on this slide, that comes from, I believe, and you know what, it's not on here. I think this came from a study that was done out of, I think this was out of a Yale article that we had posted on our site, but the information is on our website because I don't see it posted on the bottom of this slide. But anyway, it shows on here the window period for infection as well as the decline and when the healing or the recovery period occurs within an individual. You can see on this slide, there's a navy blue line that shows from 0 to 5 an asymptomatic stage and the onset of symptoms. When we do the testing, the PCR testing, we're trying to catch individuals either at that asymptomatic stage where they could be spreading the virus, as well as when they have that onset of symptoms. And you can see that window period goes up to just a little beyond 7 days. Then there's something that happens when our body starts to produce antibodies. And you can see that IgG production begins somewhere between day 7 and day 21, and then it disappears. And then we see IgM is detectable, where we can pick up the virus from day 7 to day 21, and that disappears. And then you see the onset of the IgG, which is the production of the antibodies that occurs around day 14. So when we're looking at that isolation period or that quarantine period for that first 14 days, we're looking at when a person could be incubating the virus, where they can be infectious. And when that antibody testing is done, it allows for us to see from 14 on, if your body mounted any antibodies, you can test for that and you can see that that person has recovered from the virus itself. And so there's two things that we can do to actually have a really good indication of what the disease burden looks like in our state and in our community. That's the PCR test to test for active disease, and then that antibody test that lets us know who's had the disease and who's recovered. The PCR test is something that's offered free testing through various opportunities, either through our public health department for the testing that we're offering, through Convenient MD, through your private practitioners, um, and also through some of the commercial labs. The IgG or the antibody testing is something that's currently only being offered through the commercial lab. And on our website, we have some information of where you can contact those commercial labs to see if you can get that test. That test is not free. It costs about $119 to $120. And individuals can go online and order that test, and they can take it to one of those commercial labs and they will run that sample for them. Now, one of the key things with this is that this virus, we're still learning a lot about it. And at this point, we're believing that that IgG or the antibody production is going to cover individuals and allow them to have some immunity. But the testing is still going on. The research is still going on because we don't know how long that immunity actually will last. I do want to thank our community, as the mayor has, for just the resiliency that we've seen and all the collaboration with all of our partners, with our first responders, with our hospitals, with our community members, period, with being actively engaged in helping us to stop the spread of COVID-19 by doing social distancing, by staying at home if you have signs and symptoms of illness, respiratory illness, by making sure that you're wearing those cloth masks when you're out in the public and you're not able to maintain that 6 foot of social distancing. All of these measures are very, very important. We talk a lot about, stopping the spread of COVID-19, and I think it's really important for us to understand and maybe even hear some of the stories of individuals that have actually been impacted by this disease. Some people have very mild symptoms. They may feel like they just have a cold. Others may have even more stronger symptoms and they feel like they have the flu. They have muscle aches. Some people have such extreme exhaustion that they can't even get out of the bed. How do I know this? I'm doing some of the case investigations. I have the opportunity to talk with individuals, when they come back positive, to identify these cases and their contact. And I'm hearing all kinds of different things that individuals are experiencing. Some people have been so sick that they have been in the hospital. And although we only have a 12% hospitalization rate, that time in the hospital is not a fun time for these individuals. They're having a hard time breathing. Some individuals are put on ventilators. And although we have, some folks that may not seem like this is a big deal, that is a big deal. It's a big deal for these families because they can't visit their loved ones when they're in the hospital. So they're in there being taken care of by our frontline hospital staff, who then are putting themselves at risk, but that's their jobs. And they know that, and they're dedicated to doing that. And they're dedicated to taking care of our loved ones. We do this and we put out this information because we really need our community to continue to partner with us, to continue to collaborate, to continue to work with us, to continue to take those measures that we're asking people to take so that we can reduce that hospitalization rate and we can even reduce that 3% death rate. Those losses are big losses for our community, and they're big losses for our family members who then can't even have proper burial services or funeral services for these individuals. And so we're asking you to continue to work with us, continue in our joint endeavors to stop the spread of COVID-19 and to just bring an end to, what we're seeing as the stay at home and not be able to come together as a community. We will be able to do that, but that's going to all have to be done very measured, very slowly. And as it was presented by the mayor, when we start to see that decline in cases, not just a leveling off, but an actual decline in our cases, a decline in our hospitalization rates, then we'll know that we're ready to open up our city and open up the activities that so many of us are missing right now. But we want to make sure that we do that in a safe way so that we can spare the lives and spare the sickness and the discomfort that others have to feel that end up sick with this, whose immune systems just don't tolerate this virus as well as others do. Thank you for listening.
All right. Thank you, Bobby. So I'm Justin Cates, Director of Emergency Management for the city. And I just want to give everyone an update on the work that our 7 task forces have been working on over the last week. Bobby gave an overview of some of the work that's being done with the Public Health Response Task Force, which has done a major shift over the last week or so around this really sizable rollout of a community-based testing program. So this is going to continue to ramp up, continue to see more testing out in the community, and her team has been really committed to making that happen. The Municipal Continuity Task Force, which our office is leading, has been focused around planning for the reconstitution of some city functions when the governor does provide some additional authorization for community services to open back up. One of the things we want to be prepared for in the city is to be able to open up those services that require an in-person visit. And we're also considering some of the other services that are provided out in the field as well. There's more guidance that's coming out from the CDC, the state, around some of the actions that we can take as city government to prepare our facilities, to prepare our employees, to really make sure that we're all doing our normal duties in a safe way in this new COVID-19 world. And so we're continuing to take that those best practices, that guidance, and operationalize them for our city employees. And we'll continue to build that planning out over the next few weeks. The Economic Recovery Task Force that Tim Cummings, our Economic Development Director, is leading has been doing a lot of work around the economic recovery strategy. They had a meeting again today where they were buttoning up some of the last pieces to that initial draft of the strategy. And there'll be more information coming out about that to the city so that people can get an indication of some of the future services that the city hopes to provide as we move into the long-term recovery phase. The other thing that's important to note for the Economic Recovery Task Force is that there have been all the necessary approvals to make the COVID-19 Impact Fund a reality. So more information will be coming out about that in the coming weeks about how to apply and eligibility and all those components as well. The Homeless Support Task Force has continued to work with the homeless shelters and other support services within the community to provide the necessary supports for those who are experiencing homelessness and are dealing with the COVID 19 circumstances. There were discussions about the opening of a surge capacity over the Daniel Webster College campus that the state would be running. And that's actually been put on hold because the local community has identified other alternatives to being able to provide access for those that are homeless and some other options to help reduce the surge needs within the community. And then the Child Care Task Force has been, over the last few weeks, monitoring the status of child care facilities as well as the needs of essential employees that need childcare services in order to keep their ability to operate at their critical services. But one of the things that they've shifted their focus on in the past week or so has been around summer camps and summer activities. We know that that's going to be a challenge in the coming weeks as we identify services that want to start reopening based on the governor's guidance. We're going to need to increase our capacity to provide summer support to children as those services reopen. So Megan Karen from the Arlington Street Community Center has been leading that effort and will continue to provide support in that area. The School Issues Task Force has continued to work around remote learning, graduation. There's many concerns that they're dealing with on a frequent basis that, as you heard from Dr. Mosley last week, they're constantly staying on top of the next steps when it comes to summer school and summer feeding and those types of activities. And Community Distribution Task Force, I'm actually going to enable Sarah Marchant to talk a little bit about because she's been at the focus of this over the past month and a half or so. And it's done a great job at coordinating the resources the city has to provide in this area, but also serving as really that direct liaison with the nonprofits in the community who have been doing some really amazing work to help distribute meals and supplies and services to the community. So I'll turn it over to Sarah.
Great. Thank you, Justin. So, Sarah Marchant, the Community Development Division Director, and as they said, I'm just one part of the massive team of city people who are really working to do the best we can to help the community through this transition. Through the Community Development Task Force or the Community Task Force, some almost 40 or more groups of community nonprofits are regularly involved in a call 3 or 2 days a week to coordinate essentially supplies, donations, and any communications that we really all need to be on the same page with, because these groups are out there day to day on the front lines doing some really hard and important work. One of the ways that the city stepped up pretty quickly within community development was to shift the transportation system. The Nashua transit system normally runs fixed route and on-demand service for ADA compliant and seniors. We switched it, noticing right away and working with public health and the mayor on the social distancing guidelines and not being able to necessarily comply with those on our fixed route service. So very early on, we shifted our whole system away from a fixed route base to on-call van service. This has been tremendously successful, averaging with massive growth. And you can call the number for the same amount as a fixed route. We come pick you up and bring you to your destination, but we are able to limit the number of people on each van to ensure social distancing. If you can go to the next slide, please. The other way we were able to partner with our friends in the nonprofit community is they had a need to get school and lunches and breakfasts out. And so I'm working with United Way, the Nashua School District's food distribution, the kitchens there, and some of the other organizations. We are providing Monday, Wednesday, and Friday 4 buses that travel 4 different routes, as shown on the slide here. They give out bagged breakfast and lunches, 2 for each day. And on Fridays, the Soup Kitchen and the United Way and the Boys and Girls Club also bring fresh produce to the same locations, so that there's a fresh produce and some extra meals to get people through the full weekend. This has been tremendously successful, and a huge shout out to our bus drivers who participate and the transit system for being able to adapt their whole mode of operation in such a quick turnaround. Next slide, please. One of the other things that the task force is focused on is how we can donate effectively and how do we get donations to these nonprofits in a way that they can best use them. In the past, when we were out shopping, people would buy, say, extra things with peanut butter, extra pasta, and be able to donate to our food pantries and our food kitchens. That just isn't the case now. There's too many hands touching things, and it's very hard to buy additional items that are non-perishable and shelf-stable type proteins. As you probably know as well, those are harder to find at the grocery stores, easier now, but especially when we started. So one of the most important things is being able to donate cash so that they can put resources exactly where they need them. A lot of our food pantries also buy food from the New Hampshire Food Bank, which they can get a pretty tremendous discount on food if they go through that process. So being able to donate cash where and knowing that it gets exactly where you want to go safely is important. We were able to coordinate with all of the different groups to create the graphic that is here on the screen in front of you. It has a link, a website on the city page to all of the nonprofits' websites and a direct link to their donation pages that are already set up. So if you're looking for a safe place to donate that you know has been reviewed, you can just go one-stop shopping right to our website for donations to our nonprofits in the community. Next page. The big item that's this weekend, tomorrow, Saturday, May 2nd, from 9 to 2, there is a community-wide and region-wide food drive going on. If you're going out to the grocery store, please do not go out if you're not. But if you're going out, we have set up a system for donations this weekend that is very respectful of safe distancing and guidelines and how it's being laid out. But the donation drive this weekend is taking place. It's kind of hard to see on this screen, but you can check out our Facebook pages and the United Way's Facebook pages. The donation drive will support 13 different food pantries and also the Humane Society and Kitty Angels. So the list of supplies will be at each of the facilities that has agreed to participate, including some bigger ones like Shaw's in Merrimack and the Hannafords in Merrimack, to maybe some of your smaller corner grocery stores as well. And all of these donations will be picked up at the end of the day. It'll be brought to a storage location, sorted by United Way volunteers, and distributed to all of our food pantries next Tuesday. So it's a pretty quick, easy way to turn around, limiting contact and making sure we're being safe in our donation drive. Next slide. We have also coordinated volunteer hours. This is a critical documentation process for the city, as it is a huge way that the city can match our FEMA dollars coming in. So volunteer hours are incredibly valuable, but they have to be tracked to be able to be a resource that the city can use to match all the FEMA funds coming in. And so we've created this one-stop shop. It is a website, and a lot of our volunteers are using this site in our nonprofit organizations to track their volunteer hours. You go in, you sign in your volunteer hours. It's quick and easy, and then we can send reports back to your organization, but we will also use that information to justify, to match a lot of the FEMA dollars coming into the city, and it saves taxpayer dollars in many ways. So we are really appreciative, and thanks to our GIS team for helping to set this one up as well. Next. So some of the other ways that the community task force has focused its group effort is we've done some PPE group purchasing to save money and allow for larger bulk purchases of supplies to come to our community nonprofits that are small in nature and don't get the preferential pricing of larger bulk orders. We have been sharing resources, communications, and support. One great example is some of our nonprofits deal in housing and say they have clients who are elderly who are just not sure where to go for certain resources. And it seems like there's a lot of things and a lot of things are changing. And so with this group, working with Jessica of the Food Council, we were able to put together quick flyers like this that can be posted around and shared about where you can get services, everything from how do you call to get your on-call van service to where can you get free food, what are the hours and how are those operating, and where you can get other general resources. One of the things that's really important now, and I think will be even more important in the weeks to come, is if you need financial assistance for your rentals, for your rental property. The welfare office, but there's several other organizations that are here to help, and that's incredibly important to stay current on your rent and your utilities. And so there's all kinds of resources out here that we're trying to put into one spot to make sure you know who you can reach out to and call for those resources. I think there's just one more slide. Yep. So lastly, in the community development division, I just wanted to touch on some things that we're doing. We are virtual in large part. We are operating remotely, but we are operating. If you have land use board applications, the building department, planning department, zoning department, we are here to support you, and we will walk you through that process. We are still having our meetings and moving things forward. The building safety department is issuing permits, so don't forget to apply. They're also doing inspections, and we have recently rolled out new virtual inspections. It's our inspectors are an amazing group and can do outside inspections safely, but to be able to go into homes is not necessarily what are safest for everybody. And so we've rolled out a new way to do those inspections virtually to keep you on track with your projects and our contractors on track with their projects. Code enforcement is there as always to support our rental housing and property owners. And Urban Programs has been working very hard with economic development to roll out the new COVID-19 Impact Fund. That there should be a press release early next week about when the applications are coming out and how that fund will turn around. But Urban Programs has been working hard to look at how we can use the new CDBG funding that came in from the CARES Act to support COVID-related impacts to our nonprofits and business community. So there's a quick overview. Thank you very much. Justin?
Well, I guess we're ready for questions now.
All right. Hey, everybody again. Adam, it looks like you're the only reporter on, so have at.
Yes. Are you all able to hear me all right?
Yes.
Yeah.
Excellent. Yeah, I was curious with the testing that's going to be occurring next week on Monday and Tuesday, what the goal was, how many tests you're hoping to complete over the course of those 2 days.
So, Justin, we're trying to get at least for the longer 3 to 7 testing that's going to be done on Monday, May 4th. We're going to try and get at least 150 folks through that testing. We had some success last week with our testing to be able to do that. The staff that work through those mobile drive-through clinics now have had the opportunity of having the experience of seeing how it flows. And so we're thinking we can get at least 150 through. On Tuesday, we're going to try and get, it's half the time, so we're going to try and get at least 75 individuals through on May 5th between 1 and 3 at the National Public Library. We also have 2 other sites. I just got it confirmed, the church on West Hollis Street, St. Louis de Gonza. We're planning to do a clinic there on Friday, May 8th, and that will be another drive-through from 4 to 7. So we're trying to get at least 150 through the 4-hour clinics and at least 75 individuals through those 2-hour clinics.
Excellent. I was curious if there's any certain criteria folks need to meet when they're calling in to set up an appointment.
So the HON, or the health alert that went out earlier this week, the Public Health Department has expanded the testing. And so we're looking to allow for individuals who would not normally have access to testing because either they don't have a primary care provider, or they may have called a primary care provider that has told them they don't have enough symptoms, and so they may not test them. We will test those individuals. And the reason why we will add them is because just during our investigations, we've learned that people's symptoms are, some are very mild to none. And when those individuals were tested, they've come back positive. So we've seen that happen in the testing opportunities that we've been involved with. For instance, with our cluster testing that was done at the Huntington, we saw that. Through the testing that we just recently did last week, we actually had positive cases come back through that as well. So individuals that don't have any symptoms but may have been exposed to an active COVID-19 case, individuals who may be caretakers for folks that may have immune systems that are compromised, or that may work in group home settings, or may be doing home visits like the visiting angels. So they may not be healthcare workers that are considered frontline staff, but these are still essential workers that are still doing home visits with individuals that may be homebound or that need extra support in their homes. We're going to test those individuals as well. We're going to test individuals that work at the shelters like we did yesterday, individuals who just may have underlying health conditions themselves. We want them to get tested so that they can be safe. We also are going to test individuals that are over 60. So since the testing criteria has expanded, we are also willing to test individuals based on that criteria, or individuals, again, who feel like they need to get tested. We're going to test them.
Definitely. And I suppose just lastly, has there been any update with the situation occurring over at the Huntington?
The Huntington has stabilized, and so there hasn't been a new outbreak there. They have had a few other cases that were positive after their outbreak, but those have been like 1 or 2. So things have stabilized there. As far as our other long-term care facilities, we haven't had any outbreaks. There may have been 1 positive to 2 positive cases that may have been in 1 resident or with a staff person, but those have not met an outbreak criteria. Basically, what we're seeing in Nashua, which is really good, is that things are being managed really well, even at our hospitals, with their capacity, with the cases that they're seeing. Nothing has taken us above surge capacity in any way or form or another at either one of the hospitals. And so we're looking really good in Nashua. And I think the reason why is because, again, our community is working with us. We have people that are adhering to some of the measures that have been put in place. We also know of a number of folks that are not adhering to those, and people are still out without their masks. People are still getting together, ignoring the social distancing, or not staying 6 feet apart. And we really want to, implore those individuals to do that. Like I said, again, during the case investigations, just hearing people struggling to breathe, that's not something that we want to see continue to happen with people in our community. And so for those who don't think it's something serious, believe you me, it is.
Excellent. Thank you.
Adam, do you have anything else?
No, I should be all set. Thank you.
Okay. Mayor, would you like to take us out?
Thank you all very much for tuning in. We will update you, and we're trying to keep you informed as much as we can. So we'll be back in a week or so.